Hello, everybody. I'm Mario Liniades, and this is The Art of Science. Today, we have a joint broadcast. I'm broadcasting from Rio de Janeiro. And on the other side of the line, we've got Dr. Florian Kongoli, still in Japan. This is why this is The Art of Science Japan. But before we have the opening video here, we'd like to talk a little bit about our sponsor. It's SIP, Sustainable Industrial Processing Summit and Exhibition, and it's sustainability through science and technology from the 27th of November to the 1st of December in Hilton Phuket Acadia Resort and Spa in Phuket, Thailand. For more information, floatin.org/SIPS 2022. Well, let's get to work. Let's watch our opening video here, and we'll be back with Dr. Florian. Good morning, and thank you for your audience.
Peter Osamu.
Hello, Dr. Florian. How are you? Good morning. I mean, for you, it's not good morning. For you, it's good afternoon, right?
Yes, no, actually, it is we are in the evening.
Oh, it's evening
we have
already.
12 hours difference.
Oh, yeah, 7:40 in the p.m., right?
Yeah,
And,
7:40
well, for
p.m.
me,
here,
it's
7:40 a.m. there.
Yeah,
Correct.
exactly.
And
So, today we have a very special show, yes, because usually the art of science, you're you show something related to art, but today it's very related to science. And
correct.
I would like to
Today is
have you
science. You,
science, and of course the beauty and the art of life. Because now today you have one of the most relevant specialists in cancer treatment with a very innovative cancer treatment. You have a guest. You have Dr. Osamu Kimura, and he's going to be talking about his novel immunotherapy treatment of cancer. And he's been cited as nothing but spectacular by Dr. Adan Rios from the University of Texas, McGovern Medical School. So nice to have you here and show us around. Where are you exactly now?
I'm just entering to the office to
Okay.
Tokyo CA Clinic, where Dr. Osamu Kimura is the director. So I'm just entering there, and I'm just getting inside, and it's a pleasure to meet you, Dr. Kimura.
Welcome.
It's I've heard a lot about you, and it's a pleasure to be with you face to face.
Yes, welcome. Yeah.
It's a pleasure, and we are at Tokyo CA Clinic.
Very good.
It's a very particular clinic, and we will explain why. It's a revolutionary treatment of cancer, which is completely different from what we say. So in the beginning, we're going to enter a little bit to the office, where to the meeting room, and then we can have just a simple chat. We're going to see. Nice to meet you. These are the colleagues of Dr. Kimura.
Yes.
We'll have a short discussion here. You can probably stay here and explain a little bit what really the new technique is. What is important is that cancer classically has been treated with chemotherapy, with radiation. These are all classical techniques. Here we have a completely different technique, which kind of revolutionized the way of treating cancer. And this is the immunotherapy. I'll leave the doctor to explain, but the idea is completely different. The way of treating is completely different, and the results are really, as you said, spectacular. While quoting the University of Texas MD. So, Professor Kimura, explain a little bit of this technique, which is actually it's immunotherapy, treating cancer with immunotherapy.
Okay. First of all, welcome, Dr. Florian.
Thank you.
And I'm so glad to see you here in my office. And, yes, what I'm doing here is quite unique. Uh, it's a main to state-of-the-art procedure we are doing, especially for patients with advanced cancers. And uh, almost all patients were once given up by the treatments, yeah, the treatments by the doctor. So disappointed. I saw many people, many patients who were suffering from advanced cancers, and we developed the treatments. And to establish effective anti-cancer immunotherapy, it is very important uh, to do these things written there, reading many basic medical science paper, research paper, clinical research paper, and watching patients' problems and responses, and thinking pathophysiology behind the symptom. And if we lose patients, we should analyze the cause of the patients, why we couldn't save patients. And those things so inductive approach, because the medicine is inductive approach patients, not so um, pure science like statistics or physics. So we have to look and see so carefully the patient because the answer is in the patients. But we have to produce some new things based on basic science, right? So we are always reading basic research textbook, and many anti-cancer immunotherapy trial, special trial, they wanted to kill cancer cells only. But it is also true that the cancer cells can grow with the help of our immune system. So we have to analyze everything. What is helpful for the patients or what is helpful for the cancer cells in the field of the immune system. Okay, so the cancer is a disease of the cell abnormal metabolism and change their behavior, but also the disease of the immune system. Okay, and to do so effective anti-cancer treatments, there are so many steps we have to consider. Okay, and this illustrates the basic concept of the anti-cancer immunotherapy. And in the core, the first of all, yes, we have to do induction of the cancer-specific killer cells to kill cancer cells. Okay, and to do it, we have to use antigen-presenting cells because antigen-presenting cell is like a teacher to teach our soldiers, our yes, killer cells, about the information of the cancer. Without that, no effectiveness we can get. But that's not enough. Those things were elucidated in my clinic. And as you can see, the key components of our treatment is from A to D. We are doing every steps by this order. The first, controlling patient's innate immune system. Without this, the response we can get appropriately and enough. B, controlling cancer microenvironment. Yes. In the cancer microenvironment, there are so many hurdles, like a barrier to kill cancer cells. So we have to control it. Without it, inducing cancer killer cells almost impossible. And C, low dose radiation. Yes, radiation therapy, almost all people believe radiation can kill cancer cells. But our way is quite different. We use only so low dose radiation to induce cancer cells immunogenicity high. Okay, if cancer cells immunogenicity so low, killer T cell can't find cancer cells. So we need to make cancer cells so easily foundable by T cells, killer T cells. So it is
So,
inevitable.
so basically, for the general public, the T cells are normally kind of soldiers. Correct me if I'm wrong.
Okay.
Are kind of soldiers of the human body that protect the human body from any microbe, any virus, and they're supposed to protect from also from cancer cells. But since cancer cells are not a foreign body coming from outside, they are not able to, they are not detectable. T cells basically sleep and then do not detect cancer cells. So you need to do this is the key point of the doctor's technology and treatment to make the cancer cell detectable to the soldier that protect the immunity of human body. That's correct.
Okay. Yes.
So this is the key to make the cancer cells detectable and then to fight them. Yeah, please.
Yes. So after that, the cancer microenvironment controlled and the patient's innate immunity controlled. Yes, we can think we should be prepared. And the next step is, yes, inducing cancer-specific killer T cells. And we are doing that by injection of the antigen-presenting cell, dendritic cell, in directly into the tumor, and that is so helpful. But it is, yes, as I told you, it is very important to do from A to C to make dendritic cells working so properly and effectively to get the information, and to transfer the information to the T cells. Okay, but yes, but actually, my treatments developed from the opposite direction. Okay, and this shame illustrates the concept of cancer vaccination, but doesn't work. It doesn't work at all. Yes, actually. So if some clinics insisting we are doing our cancer vaccination therapy and it's really effective, it's a fake. It's a fake. Okay, and it is also true that the cancer cells always changing their shape. Yes, yes, technical term, they're changing their clonarity. And the solid tumor consists of so many clones, different clones. So sometimes it's very difficult to control all of them. But yes, by injecting dendritic cells into the tumor directly, the dendritic cells can detect the real live neoantigens of the cancer, and the dendritic cells can spread and transfer the information to the killer cells, and the killer cells can attack.
And this is one of the key. Sorry to
Yeah,
interrupt.
yes.
This is one of the key of the technology of the treatment. Just to make it a little bit understandable for the normal people. What's the difference? We are injecting the so-called dendritic cell directly to the tumor. What is the purpose? To make this tumor, visible or detectable or foundable by the T cells. T cells are the cells in the human body. Everybody has those that are in charge to protect human body from viruses and any foreign agent. But since again cancer cells are coming, are reshaping our human body cells that are transformed into cancer cells. These cells are not able to detect them. So this dendritic injection directly to the tumor makes them visible, and by makes them visible, the T cells are able to fight the cancer because they know really where is the army that we have to fight. Otherwise,
So,
you will not be able to fight.
let me see if this is usually cancer cells because they have the same DNA as us. I mean, they're
Yes,
produced by our body.
exactly.
They're
Exactly.
invisible. And now
Exactly.
injecting the T cells into the
Injecting
cancer
by
cell.
dendritic cell makes
see.
him visible to T cell that protects body.
Very amazing. This is like
This is amazing. This is
yeah.
the key point. Now, this is the concept.
Uh-huh.
And then it is a whole procedure to achieve that. And then I let the doctor.
Okay.
So
Yeah.
I'm trying to vulgarize it for the general public.
Okay. Okay. So I can show you the example. Yes. As you can see,
This is the result. Very important. Look at this carefully. Look at this.
Yes.
This is amazing.
I saw this patient 5 years ago, and he was diagnosed stage 4, so advanced prostatic cancers. He had so wide bone metastasis everywhere of the vertebrae and skull and femur. So many severe bone metastasis.
So the black points in the left are bone metastasis, cancer bone metastasis because of the prostate cancer, correct?
Yes, and yes, every doctors told him there were no way to to do effective treatments, and all the patients can do was just go home and wait to die. And at last, he came to me because he was the father of my staff. So I did injected dendritic cells into his lymph node metastasis and gave him so small amounts of nivolumab. I did only that. And 2 months later, 2 months later, the tumor marker PSA, which was elevated to 825, the normal range below 4.0, decreased 0.3, and all tumors gone.
This is huge. All technologies today in cancer treatment are based on chemotherapy, radiation therapy, and they continue for years and years and years. And the purpose is not to kill the cancer, to stop its development. The person never, cancer never disappears from the person. It stays where it is. The purpose of all this treatment is to keep it static and not to develop further. Why? Because of the nature of these technologies. Here, Dr. Kimura has developed a revolutionary technology. It's called immunotherapy. It works completely different. The principle is completely different, and the way it works is completely different. The key point is for normal people to understand is that uh, each human body has a particular organism, the T cells. These are like guardians of human body. They fight the viruses and any other foreign, kind of coming to the human body. However, human cancer cells are the origin of cancer cells come from the body itself. As such, they are not detectable from the T cells, which are the guardians of human body. So as such, T cells basically sleep. They are not able to detect the cancer cells. And here, where Dr. Kimura has developed this revolutionary, treatment of cancer, because he's able to inject the dendritic cells at the tumor, and this injection, just a small injection exactly at the tumor, this makes the tumor or cancer cells visible to the T cells, the guardians of human body. And now these T cells are able to fight the cancer, not to keep it as it is at the same level, not to develop further, but to kill it. Did I explain right, Dr. Kimura?
Yes, thank you, Dr. Florian. And yes, as he explained, it is very important to induce patients cancer-specific killer T cell. But yes, as you can see, it's not enough. In the tumor, yes, there are many cancer cells, but other cells, immune cells also exist to protect cancer cells. So if we want to erase tumor, kill cancer cells, we have to yes, attack cancer cells, but also we have to do control um, in the tumor immune cells, and those cells are working as a side of immunosuppression. So without controlling those immunosuppression cells, we can't get a good response. Okay, and yes, for example, yes, we are using, of course, anti-cancer drugs, but the difference is the dose. Yes, as you can see the graph, if the dose so high, the chemotherapeutic agents can kill cancer cells and normal cells. But if the dose is so low, those agents can't kill cancer cells and normal cells, but yes, they can stimulate immune response. So we are using these kind of phenomena to control cancer microenvironment, which is inevitable to kill cancer cells, especially for the patients with advanced one. Okay, the patients had suffered from intestinal malignant lymphoma for over 16 years, and some university hospital, so famous one, tertiary center, but they can't control the growth of this tumor, and she was dying. But she came to me at last, and I checked her data for 16 years, and I found, yes, she already successfully induced her cancer-specific killer cells. So my advice was to control her cancer microenvironment, and I gave her only one pill. And only one pill is very useful, helpful to reduce the number of regulatory T cells, which is in the tumor and protecting cancer cells. And in only 1 month, her tumor all gone. I did nothing to kill cancers. Yes, for this patient's target was the immune suppressive cells.
So you count, just for the general public, sorry, doctor. On the left, you see so many black dots that are cancer metastases, and on the right side, you see that most of those have gone. Is this clear, Mario?
It's fantastic, Dr. Florian. I'm
It's
really
fantastic,
impressed.
correct.
I'm really impressed. Serious.
Yes. Today, I can't explain all of the important things, but yes, as
Oh, Dr. Florian. Dr. Florian.
yes, this
Tell him he doesn't
this
have to
kind
explain
of
everything today,
breast
but
cancer
we are
can
looking
easily
forward to having him on tips.
erased and disappeared in 2 months, and she can live almost on 3 years with cancer free. It's not difficult.
So these are only examples. So we're not going to go to the details of the treatment. It is better to show the examples how this has been. What are the success stories? He's suggesting that in order to people are very interested to see the success stories.
Yes. Yes. And there is also yes, this paper simulate the Star Wars, the dark side of immunotherapy. Yes, the author described in this paper as anti-cancer immunotherapy is getting popular and popular, but pancreas cancer is quite different. It's not a candidate for anti-cancer immunity, but yes, in my clinic, so advanced pancreas cancer, I can erase them all in 2 months so easily.
What you see in the screen is the tumor marker went from 127 to 20 in about 2 months.
It's impressive. It sure is impressive.
Yes, it is impressive.
There is
And
something.
he said it's one pill.
Yes.
Dr.
Well,
Florian.
depends. It depends. It's not one pill. Depends. It's a treatment. It's a treatment, but this is specific to each person.
Okay.
That's why we inject the dendritic cells. So it is a treatment. Depends. Could be simple, but the doctor can explain because he's asking. It's always one pill.
No. We have to combine so many pills, and it's different from patient by patient.
Yes, that's what I said. So I understood correctly.
Oh yeah. Okay.
Okay, good.
Great.
Very
So
good.
please,
Close more.
please.
And this figure shows the system of the innate immunity. I explained you about the adaptive immunity, how to kill cancer cells with adaptive immunity, but to make it work so uh, effectively, we have to control innate immunity because yes, as you can see, we our innate immunity divided into two sides. One is M1 side and the other is M2 side. If our innate immunity shifted to M2 side, anti-cancer immunity doesn't work. So we need to keep patients' innate immunity to M1 side. And that's also very important.
So, and some other success stories. For example, you mentioned that 92 years old person with severe tumor.
Yes. There are so many patients I got cured.
I think these are mostly people are interested.
Yes. How about these patients? 92-year-old a male, and with our left sinus cancer, and he was judged by some professor in the university hospital. It's impossible if we were in the world because this tumor is so extended, and the tumor melted the upper jaw bone and protruded into the oral cavity. And surgery impossible, and chemotherapy may be impossible for this old man, 92 years old. Radiation may be not terrible to get an effective response. But yes, in my clinic, it's the story is quite different. And yes, first of all, yes, I did control this patient's innate immunity and cancer microenvironment. 2 weeks later, the tumor, yes, quite shrink. Yes, he responded. And yes, please remember his age was 92. And during this treatment, in yes, 2 weeks, 2 weeks, he was getting better and better and getting fine, so fine. And his son so surprised to see, yes, his father got recovered completely. No, 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 they're still cancers yet. So I told them, yes, let's do induction of his cancer specific killer T cells. And 3 weeks later, 3 weeks later, the tumor all gone. So it took 5 weeks to make all gone. So maybe you can see that something happened there is quite different from the usual standard chemotherapy or standard radiation. No, quite different. But yes, I can make him cure so effectively with no side effects almost.
And any other example you showed?
Yes, and yes, for example, yes, this is lung cancer patients. Lung is a small cell lung cancer, and it's the most difficult one. And yes,
And you see, Mario, you see the black dots. The
Yes,
black
Dr.
dots.
Florian. Yes, yes.
yes,
Perfectly.
the
Perfect.
lung cancer and bone metastasis and lymph node metastasis, systemic metastasis, and but yes, doing innate immunity control, the tumor marker getting down, and low dose radiation, and in 5 weeks, the tumor all gone.
Or 60 years old female, 68 years old.
With minimum side effects like a skin rash or itching, and yes, she's so fine.
And any other example?
And
success
so many successful. This, yeah, the control, yes. 44-year-old female with breast cancer so advanced with lung metastasis, bone metastasis, liver metastasis, skin metastasis, and maybe every doctors in the world will give up the treatment for her. But yes, doing a dendritic cell injection or controlling her innate immunity cancer microenvironment, yes, 3 months later, almost 90% of the cancer cells gone, and she's still fine. Yes, 1.5 years passed. So, and she is getting better and better without any hair loss or without any so exhausted situation. Yes, yes. The patients in my clinic got so fine just after starting the treatments. Yes, so it is also important not to injure patients because if some injury happens, patients have to recover from that injury, and the recovery from that injury makes immunosuppressive side of the immunity can make some barrier around the tumor cancer cells. So it is very important to take care of not to injure the patient's body, tissue, cells, organs, and that's also another key points.
So there are no type of side effects that we hear happening in chemotherapy or in radiation therapy. Here there do not exist or very, very minimal, correct?
Yes.
Now, Dr. Florian, let me ask you a question.
Yes.
Please ask the doctor a question. This kind of treatment,
Maybe you can see.
how long
just a
does
moment.
it take? I mean, the patient goes to the clinic, and I mean, what's the process? He takes the injection, goes home, he stays in the clinic. What is the process?
Yeah.
The
He's
the
asking
treatment.
what is the process, how long it takes, and how it looks the process. The process of treatment. The treatment.
Uh-huh. Well, yeah. The first of all, yes, that's a good question. But as I showed you, the process should be, yes, you have to do the order from A to D, and it's very important. Without this order, anti-cancer immunotherapy is so dangerous because yes, the immunity we have two sides. So not appropriate anti-cancer immunity may induce tolerance to cancer cells, and that may help cancer growth. So the order from A to D is so important, and the period we need is from 1 month to 3 months for the first session. But because our treatments make so little adverse effects, so it can be repeatable.
Can be repeatable without side effects.
Without side effects. So it's also the great benefits.
So 3 months you could have a visible and drastic effect of the treatment.
And
I am impressed. I have to say that.
Yes, this is impressive.
This
This
is
is
something
impressive.
that this is breakthrough in science because in the
Yes.
treatment of cancer. Because well, congratulations to the doctor
Yes,
because
he's congratulating you because
yeah.
he has a personal story with his father. I'm going to go later, but this is another example. A 34 years old male.
Mhm.
yes, this is the patient with mixed liposarcoma. Liposarcoma so difficult to treat, and the only way is surgical removal. Yes, and yes, for these patients, some other institution did surgery, 2015, but 4 years later, the tumor recurred in abdominal cavity, and they did repeated chemotherapy and radiation, but nothing helpful. So, yes, as you can see, in the abdominal cavity, full of tumor, so hard, and estimated tumor weight should have been over 30 kilograms. And he was discharged from the hospital after he was told by his doctors his life expectancy should be less than 2 weeks. But he had the little child, and he couldn't give up, so he came to me, and I told him the effectiveness. I cannot promise him because it's so hard, but my treatment is under so rapid development. So I told him there may be some possibility that I can do something good for you. So I did. I did it. Yes, this is the picture of his abdomen, and yes, yes. Please remember, yes, he was told by his doctor his life expectancy was 2 weeks, but 2 weeks after starting my treatments, his abdomen got so shrinked. And 1 week later from here, his abdomen so shrinked, and his edema of the legs are getting better, and he can, yes, he got, yes, so, yeah, maybe, yeah, just like normal people, and he could play soccer with his son. So
these are
That is impressive. I mean, the whole thing is impressive, but I mean, 2 weeks. He had 2 weeks life expectancy, and he was playing soccer with his son very shortly after. That is impressive. Serious.
has been done. Please, doctor, the cultivation. What do you do? How you treat the cultivation?
to tell the truth, I'm not, yes, I'm not so well informed about the detail of cell cultivation, and I always order the technicians and specialists to do to make this type of something better function to do it. So the secret to make it, I don't know, but the concepts or the direction, I always order those people to make them effect.
So this is the in to the tip of iceberg of this treatment, which has been so successful, and we saw so many examples, success stories, and this without side effect, working completely different in terms of immunotherapy, and without not through chemotherapy or radiation, to keep the metastasis at a stable level and not to be developed further. This uh, attacks the cancer cells, and kill them in that in a particular way because of this new technique. So we can have a short. Did I explain correctly?
Oh, of course, of course.
Okay. So this is the key: immunotherapy and balancing and managing the relationship between the immune system and cancer cells. So, and giving the right signals and the right information to T cells that protect the body, that are protection of the body, to attack cancer cells and to kill them, and thus managing this relation, which is individual for individual person. Normally takes the results can be seen depending on the person, depending on the severity of the cancer or the metastasis, will go from 1 week to 3 months. Sometimes might go a little bit more, but what is important is that the cancer is gone. The cancer is killed. It's not assured the stability of the cancer where it is, not to be developed further, but it is killed. And this is the key point of this particular immunotherapy for cancer treatment. Any other?
Dr. Florian, let me ask you a question.
Yes, you're so smart to understand.
Thank you.
Let me ask you a question, Dr. Florian.
Marius has a question. Yes.
What is the percentage of success in the treatment? I
He's asking
mean,
the
of course, it's
percentage
individual.
of the treatment. The percentage
Oh,
from
yeah. You can see the slides. Yes.
Mhm.
Yes, initial 17 cases, the CR rate 18%, partial response 59, and as the response rate are over the DSD, PR, and CR, so 82. But these years, the CR 31, and PR 55.
But in order for some of the response rate, with the term response rate is a success rate.
more than
80.
stable disease response rate, and 88%. And yes, the character, yes, the CR, yes, complete remission rate is increasing, and I think yes, this complete remission rate is increasing more and more. Maybe in a couple of years, over 50%. I think.
So it will be more than
That's
50.
impressive. That's impressive.
Yes.
Serious.
Right. That's impressive. That's impressive.
Especially after seeing the cases he showed with metastases, with low life expectancy. So this is really impressive. Serious. It's nothing
Yes.
but spectacular, as the doctor from the Texas University said, the University of Texas said.
Yes. Yes, it's spectacular actually. So we can have a short visit to the lab, and then we can go and finalize this live.
Perfect.
Sure.
Uh-huh. Okay,
Unless
let's
you
walk
have more
around them.
questions.
I'm anxious. I'm looking forward to seeing it.
Yes.
Let's check
Well,
it.
you will not see too much. You'll see only the lab where they do the cultivation. But this is important for people to see that it takes time and it takes to cultivate.
Can Davis hear me?
Yes, sir. Yes, sir. I hear
Very
you.
good. Okay, Davis. So let's walk around.
So here we are in the cultivation center.
This is a lot.
This is
Lot to check the
yeah.
immune response or the cell marker. We have to check all the analysis of the cell marker of the tumor and the lymphocytes. Some of the things here, and the cultivation area is from here. Yes, and clean room there.
Can you open the lights?
So
Okay.
yes.
So this is the cultivation area.
Okay. Could you step
Yes,
in,
but it's
Davis, so
enough
we
in
can
the
see a
small
little more?
We cannot step in because
I'm sorry, Mario.
Oh,
Could
okay,
you
okay,
repeat?
okay. So the closer
Okay,
he
good.
can get, just to show.
Okay.
so this is the cultivation area.
Okay.
He's asking me to get as close as possible.
But nothing special.
Wow, interesting.
Nothing
What's that?
special, it is
Yes,
most-
the special is the idea.
Yeah.
Okay. Very
so
good.
this is the
very good.
cultivation area.
Show you
Uh-huh.
the clinic.
And now we're gonna go to the clinic.
Okay. Wow, it's really impressive
To
there.
keep the patient's privacy,
Uh-huh.
yes,
Yeah, of
the
course.
waiting area is not so large. So the patients come to me and they directly into the treatment room, room by room.
So this is the clinic where patients come and are treated. Is a nurse station.
If the patient is so bad, so bad, the patient can stay in my clinic from the morning to or the evening, late evening, like
Mhm.
like in a hospitalization. Yes, this is the kind of this room, staff room, and infusion room,
They don't stay overnight, Florian.
and this.
They can stay overnight, but mostly no. This is because
Impressive.
there is no side effects. Correct, doctor?
Yeah.
So this is the difference. In chemotherapy, you have to stay. You have to be followed. Sometimes you go home also. But here you do not need to stay in the clinic because the side effects are so minimal or close to zero.
So yes, mild one we frequently experience, but not severe one.
So there are minor one, but not severe one.
Yeah.
So that's why they do not need to stay
Yeah,
overnight.
yes.
Overnight.
Yeah, this room is for the endoscopy and ultrasonography and yes, some surgery. Yes, I can do that with this. Okay. So small clinic.
So it's a small clinic, but the results have been
Uh,
impressive.
Dr. Florian, if you could ask him, for example, is this treatment exclusive of his clinic there,
This
or is it
picture,
being
yes,
reproduced in other
from a
clinics around the
patient
world?
gave
Uh,
us.
His question is, this technique is exclusive of your clinic only?
Only.
So that's correct. It is your own development technique.
Of course.
It's Dr. Kimura's development technique developed by him. And
Okay,
it's
but it's
not
not.
available in any other places, correct?
Not available.
So it's not available in any other place. It's his own technique, and that's why we are here. Here you have the the idea creator and the person that made it a reality. Correct.
Yeah, the passion to save people. That's all. Yes.
So that's what he said. The passion. He has a passion to save people's lives, and with this, with the example that we've seen, really, this is something particular. So
For
we
sure.
can.
Indeed. Yes.
It's if you are able to kill the cancers. And today, doctor, correct me if I'm wrong. Um, Today, all the classical techniques are to keep the status of the cancer metastasis where they are. The normal usually is doctors say we cannot make it less. We have to keep them where they are to avoid becoming bigger. So, but this is just keeping it stable. This is it's a perpetual fight. You can chemotherapy and treatment all your life, etc., etc. So these are the classical techniques.
The reason why they say is they can only that because they can't kill them all. But yes, if we can correct and adjust the after-cancer immunity, yes, I believe we can kill all the cancers. So that's our goal to kill all of the cancer cells in the patient's body. But sometimes so many hurdles, especially patients had repeated history of surgery or radiation therapy. Those things injure the body, and the body make barrier, and those barriers protect cancer cells. And so thick barrier patients have, our anti-cancer immunity can break through. So I always think people with cancers have to first have anti-cancer immunotherapy. That's yes. After they got immunity against their cancer cells, and next how to do next. So still now, most of the patients came to me after so many treatments, but it's maybe opposite. That's my feeling.
Yeah.
Cancer immunotherapy should be done first.
And what's so impressive about your treatment is that when you have patients with stage 4 metastases, usually the best you can get is stable disease for a few years. But with your treatment, the vast majority of the cases are getting complete response and partial response.
Now, the
Great
percentage
observation,
of the
Davis.
CR, configuration rate, getting increased with the development of my protocols. My protocol is developing every day. And because I am taking care of the patients so precisely, and that's my work, because the answer is in the patients, not in the textbook, not in the guideline. In the patient's body, there are answers. So we have to look and see so carefully what's happening, what's the response, and the problems we have to solve. So to do that every day, hard work, but that's the reality.
Dr. Flores, so each treatment is customized. I mean, there are not two
That is
patients with the
customized,
same
correct?
treatment.
He's asking if each person, each treatment is customized.
Of course, every disease quite different person to person. Yes.
It's fully customized, and that's why the time of treatment is different, correct?
Yes.
So it is. That's why we're speaking about cultivation. That's why we're speaking of it. You have to manage this relation between which only Dr. Kimura has found the relation between immunity and then cancer cells, correct? And this is the key.
Yes. I don't want unnecessary treatments because yes, we have to think about the cost and effectiveness, and unnecessary drugs may be harmful. So we should minimize the cost and the kind of drugs we use and make the efficacy maximum. That's the point. I'm not trying to. Yes.
Yeah. So
Very,
this is
very,
this
very
is this is the story of Dr. Kimura. I think this is huge possibility for the future.
Yes. Yes. I agree.
It is that's because it's not treated this way with the classical techniques. It's a completely different world. There are two different planets in this, two different planets that treating cancer. I guess. I guess this. I have the right to say this. So in the first classical treatment, again, I'm repeating, you need to keep wherever the cancer status it is, not to prevent going in further, to be developed further. Here you kill it and make the patient cancer free. Is this correct?
Yeah.
That's the big difference. So it's really, it's really, encouraging to be in a clinic like this because you see the light of the end of the tunnel because cancer has been exactly. You see the light of the end of the tunnel, and you feel optimistic for the fate of those patients that all have given up to cancer,
Exactly.
and all
Exactly.
other doctors have told them there is no more treatment, nothing we can do for you, unfortunately. So here there is hope. Here you might have metastasis all over your body, and you have a treatment.
I'm going to be very honest. I'm impressed because, I mean, since we've been kids, since we were kids, we've
Yes,
been
correct.
listening to how difficult it is to treat cancer and all that. And this is, you mentioned it correctly. It's a light at the end of the tunnel. I mean,
Right
you're
at the end of
probably
the
looking,
tunnel,
we are
correct.
looking at the cure of for cancer.
Yes,
From the
correct.
inside, I
Because
mean, with each person's immune system, right? This is
yes, correctly,
this is
correct.
an outbreak. I mean, congratulations to to the doctor because I mean,
He's
Dr. Kimura,
congratulating
Osamu
you for this
Kimura.
big breakthrough in treatment of cancer, and which is really something specific. So any person around the world that feels helpless,
Hmm.
that that all other doctors and all our treatment, uh, have been unsuccessful. Here they have a hope. So this is their hope. We can say their last hope because
Hmm.
if anybody has given up, any doctor, any clinic, any treatment has been unsuccessful, and any doctor has given up to them, here they have their last chance. So do not forget this. The doctor is here, so passionate. Here is around 8 p.m. now, and then he is here with us. But this is, passion about fighting cancer, and that's why, doctor, it is an honor and pleasure to speak with you and to feel so optimistic for all those people that have cancers all over their body. Yes, everybody has given up on that.
I'm so glad to hear that.
Yeah,
Thank you.
and again, you have to come here and take a picture for people to remember. Is
Yes, of
Tokyo
course.
CA Clinic,
Tokyo CA Clinic.
Clinic, and here that the hope of all those cancer patients that have no hope from other treatments, and all other hospitals or doctors have given up.
I am
So
impressed, really serious, and
yes,
I'm looking
I feel
forward to
that is
meeting him
impressive.
in person in Phuket.
Sure, sure. Well, we'll invite him for sure at SIPS to present this technology because we have, in SIPS we have new technologies. In SIPS we have new technologies in medicine, and you cannot have a really new treatment and new medicine without having this. Cancer is one of the the highest percentage of people that die from cancer is one of the highest in the world. So if it is a new technology in treatment, here we are. So we're going to send an invitation, doctor, to come and present this amazing, treatment at SIPS 2022 in Phuket, Thailand. It is end of November. It is this specific symposium, New Technologies in Medicine, is chaired by Nobel laureate in medicine, Professor Farid Murad. So we have 9 Nobel laureates coming. Most of them are in chemistry, but 3 or 4 of them have worked on cancer with chemical techniques, totally different from yours. So probably they should hear about your techniques. So there are 3 Nobel laureates, chemical Nobel laureates, that have been working in cancer, and the whole thing is dedicated to Nobel laureate in medicine, Professor Farid Murad, one of the inventor of the uh, signaling effect of nitric oxide in the human body. That's why he got the Nobel laureate.
Dr. Florian, Dr.
So,
Florian,
yes,
we already have 9 Nobel laureates
the
at
9
SIPS.
Nobel laureates participating. So
If
it's a
Dr. Kimura goes to SIPS, I'm sure that in the future you're going to be able to say that we had 10 Nobel laureates because this is Nobel Prize material for
So
sure.
he's saying this is Nobel Prize materials. No, no, no. So, but he's so modest. So he's saying that if we have 9 Nobel laureates, a little bit more in future years, probably we'll have a 10th one coming to SIPS. It's a pleasure, Doctor. Again,
Thank you.
we feel so fresh to have this technique,
I'm so
and
glad.
we wish you major success.
Thank you. Thank you. Yes.
So Mario, we finalize here, and again,
Okay.
we'll have
Okay. Thank you
an
very
edited
much, Dr.
version.
Florian. Thank you very much for this opportunity. It was really a great pleasure, a great honor to meet, to see you, and also to meet Dr. Kimura. So I'm looking forward to seeing you in person in Phuket, Dr. Kimura.
Sure.
And
In
well, this
Phuket.
is
Hopefully, Doctor, we're gonna send an official invitation to Dr. Kimura.
That's good. Well, this is the art of science today with a lot of art. I mean, not only art, this is the essence of life for science, through science. And I would like to thank everybody for the audience. And as Dr. Florian said, we had some technical issues in this episode. So we
We're
are
gonna
going to
have an
re
edited
edit.
version without those technical issues. Apparently, there was an
Exactly.
interference between the 2 cameras, and
Exactly.
the sound was switching from one camera to the other. But we're
Mhm.
gonna cut them, and then we have a clean version, edited version. Besides the real time, real time is you can never achieve the spontaneity of real time broadcasting.
No, never.
So this is the best of real time broadcasting. Sure, sometimes you have some difficulties like this, but it's worth it to be live than to be recorded, because
Of
recorded
course.
is recorded. You can cut. You can. It's not natural. This is
Yes.
natural, and that's why here we have a real time description of a new
Yes.
technology. So we'll have both real time and an edited version for people to follow us. Again, Doctor, I wish you a good night, and we'll be in touch in the near future.
Thank you.
Thank you. Thank you. Arigato gozaimasu.
Good person. Yeah. Thank you.
Well, that's it, guys. From Rio de Janeiro, I'm Mario Linares, and I would like again to invite everybody to get to know a little bit more about SIPS, Sustainable Industrial Processing Summit and Exhibition, Sustainability Through Science and Technology, from the 27th of November to the 1st of December at the Hilton Phuket Acadia Resort and Spa in Phuket Island. And for more information, just visit flowgen.org/SIPS 2022. I'm Mario Linhares. I'm broadcasting from Rio de Janeiro. And it was a big pleasure having you here. See you next time. Bye-bye.